Actually started looking at reporting tools several years ago because we knew that we would want something that was a little bit more forward thinking when it came to radiologist reporting and dictation, and also we knew that we wanted a platform that could grow with us. Multi-specialty health system, and things get very complicated. Our workflows are very complicated. And so, as I mentioned before, the data, that's where the data analytics becomes really important for us. How much are our radiologists reading? What times of the day are they reading them? Is there some sort of differentiation when one radiologist is on versus another? Is there parity across our groups? Those are questions that we find very difficult to answer. And so we're hoping to co-develop platforms around that. And eventually, my goal is to be able to develop something that's more along the lines of predictive scheduling. So we know that the right radiologist is getting the right type of exam at the right time. I think that it's both because I mean, at baseline, we need a dictation platform. That's how we all operate. So this is a technology transition. It's also a way for us to rethink how we work in general because there's so much coming out around this. If we think, what we just said, predictive scheduling, that would be a workflow change for us. Looking at how we operate with residents, making sure that residents get cases that maybe they don't necessarily see all the time, but they need to see in order to be trained well. We see this type of partnership as someplace that can eventually start to help us do that. We're really interested in the RSNA partnership with RadAI because that is a way for us to start to get information at our fingertips as opposed to having to go externally to sources, which many of us do on a routine basis. But to get confident information at your fingertips is really important. And then I personally am on the RSNA CD Common Data Elements Committee, and we're really thinking about how we're using those in report generation going forward. And so partnering with companies that can access that is another piece of that. And I do think that that will transform not just reporting, but the output on the other side of like, what do you do with the radiology report afterwards rather than just read it?